The QuANTUM-R study is a study in relapsed refractory patients with acute myeloid leukemia, and we all know patients with relapsed and refractory disease has a very dismal prognosis. However, in the QuANTUM-R study, this was even more dismal because they selected patients with refractory but also relapse and relapse within 6 months, and those patients has really a dismal prognosis. And those patients were randomized up front to either single agent Quizartinib or doctor's choice. And doctor's choice can be was either intensive chemotherapy or low intensity chemotherapy or hypomethylating agents. Most of the patients who had been randomized into the doctor's choice arm received intensive chemotherapy. And the randomization was 2-to-1, 2 parts to Quizartinib, 1 part to doctor's choice. And the results had been shown at the European Hematology meeting this year in 2018 and clearly showed that overall survival is improved by single agent Quizartinib. And Quizartinib was given once daily until complete remission was achieved. The implication of the QuANTUM-R study is that Quizartinib is available to be for patients with relapse and refractory disease, and the major implication will be the bridge to transplant in this patient population, because without transplantation, even if the patient achieve a complete remission with Quizartinib single agent, they will shortly relapse thereafter if there is no consolidation therapy, for example, with allogeneic transplantation. In the QuANTUM-R study, there is an improvement of overall survival, and this is very important because I think this is the most important endpoint patients like to know, whether they have an improvement in overall survival if they take the drug Quizartinib. And therefore, I think this is a very important study. So far, the results had not really reported in detail because we do not know the complete remission rate and also the minimal residual disease continuum, for example, during the study. However, if we see a benefit in overall survival, I think this qualifies for a very important study. In the relapsed refractory setting, patients with a FLT3 internal tandem duplication, we have now this positive study, QuANTUM-R study, and clearly we see an overall benefit in overall survival. And therefore, I think Quizartinib should be, in those patients with a FLT3 internal tandem duplication, the first choice of treatment. The question is whether Quizartinib can also be combined with intensive chemotherapy. However, further studies will clarify this question. So we know from historical data that patients with a FLT3 internal tandem duplication who relapsed or were refractory and relapsed within 6 months did really very poor. The overall survival after 1 year is below 20% in historical controls. And therefore, it's quite important to see that a single agent FLT3 inhibitors such as Quizartinib can induce responses and prolong overall survival. So this is really a step forward for these patients in the setting of relapse and refractory early relapse and refractory patients. The safety profile observed in the QuANTUM-R study was very good. So patients could be treated, and the most common toxicity was a prolongation of QTc, and therefore one has to take into account that patients have to be regularly controlled with the ECG. However, if they are regularly controlled and the QTc time is in the time limit below 500 milliseconds, then Quizartinib is very well tolerated.